It's day one for many of the summer holidays, and you might have heard in the local news that Thames Valley Cancer Alliance have issued a Be Skin Smart and UV Savvy skin cancer advice. Of course, with the summer holidays, and something we need to be more and more aware of, perhaps we're going away or heading down to the coast. I've been chatting to Dr Anant Sachdev, who's a GP and NHS Thames Valley Cancer Alliance Prevention and Early Diagnosis Clinical Lead, to find out a bit more about this initiative.
The main purpose of this campaign is to reduce the rates of skin cancer and for people to take measures to ensure that they're reducing the risk of skin cancer.
And I guess as well, there are many misconceptions people have about, how you can get skin cancer, or how you can pick up any sort of sun damage, I guess.
Absolutely. The problem we have is that the UV rays from the sun, which is UVB particularly and UVA, people are not very careful about exposure to the sun and these UV rays. All skin is at risk of skin cancer and particularly sunburn. And so therefore it's really important, even on a cloudy day, because the UV rays go through the clouds and come down into the skin. On a cloudy day, you still need to protect your skin, which is to make sure that you put on high sun factor lotions, as well as not be in the sun too long. The problem is that if any skin gets burnt or even slightly burnt, then there is a chance that skin could change and become cancerous. And so it's really important to follow the sun protection for your skin. If we look at any skins, particularly white, fair-skinned people are at greater risk of skin cancer and burning. But all skin colors and types can be affected and develop skin cancer. Darker skins in particular do appear to have risk of skin cancer in the soles, nails, under nails and palms, and such as the mouth, of lips and mucosal membranes. So really it is very important for all people, if they notice a change in their skin or any moles that have changed, that actually get some advice from a health professional by assessment. It's very, very important not to get sunburnt, because if you do get sunburnt, then your risk of skin cancer actually triples, especially if you've been burnt twice in a couple of years. So it is very, very important to make sure you don't get exposure and get sunburnt. One thing that's worth mentioning also is about sunbeds. In my opinion, this is a very, very high risk factor. And really the advice is don't use sunbeds, in particular if you're an adult, because that exposes you to high risk of getting skin cancer. It's better to actually use fake tans if you want to have a tan, and that is far better. And apply, if you're out in the sun, sun lotion every couple of hours, high factor sun lotion.
And does the sort of treatment, if you like, or what we should be doing to protect ourselves vary depending on our age?
Absolutely. I mean, I think one of the key things to remember is that any individual is at risk of skin changes which could be due to skin cancer. But in terms of age, anyone under the age of 6 months shouldn't have sun lotion applied, because the skin is very thin and very frail, and also the chemicals within sun lotions can be absorbed, and we don't know what impact it could have on individuals. So babies under the age of 6 months shouldn't have sun lotion applied, but it is very important just to keep out of the sun. Very, very important to reduce the sun exposure. There's a bit of a myth about vitamin D. Now, in the UK, the vitamin D levels for most individuals are very low, and people feel that they want to go out for walks in the sun to get the vitamin D. Well, in my opinion, and other experts agree with this, which is that a few minutes is all you need, and you don't have to be in the sun for many hours. But you should be taking vitamin D supplements from over-the-counter and pharmacies to try and boost up your vitamin D levels, which is obviously very important for various reasons, including bones. But you do not have to be in the sun for hours to get vitamin D. So it's very important that you keep covered follow the sun sort of reduced exposure and don't get sunburnt at any age.
And there are two different types of skin cancer that we should be aware of.
Yes, there is obviously melanoma, which is a very serious type of skin cancer. This is one which affects the all layers of your skin, especially sun-exposed, which are face, ears, hands, shoulders, upper back, and chest. This is a very important one because early stage diagnosis, almost 100% of people would survive for 5 years or more if they're diagnosed at an earlier stage. Whereas the later stage, which is stage 4, only about 30 people out of 100 survive 5 years or more. So the earlier stage diagnosis, even stage 2, 80% of people will survive the cancer for 5 years or more. So the earlier the diagnosis is made for melanoma, the better. There is another form which is non-melanoma skin cancers, which are things like BCCs, which are basal cell cancers. These are obviously changes in the skin, again, mostly due to the sun or on the face, hands, ears, shoulders, back and chest. These are all sun-exposed places. These are not serious cancers, which in the majority of cases affect mortality, but they do need to be removed because they do need to grow and eat away at the skin. So these are also very important ones. There is another one called SCC or squamous cell cancer, which is also quite a serious cancer. Again, sun-exposed skin. And again, this one needs removal because this can eat away to the skin quite badly. So the three different types are the melanoma and the non-melanoma ones, which are BCCs and squamous cell cancers.
So what should we be looking out for on our skin which might be a concern, if anything changes, or particular moles that we might have?
Yeah, so this is a very important aspect, and if we follow the ABCDE rule, this actually explains to individuals what to look out for. And in general, what you need to look out for in terms of signs are the appearance of a new mole or a lesion on your body, any change in the existing mole, such as change in shape, bleeding or itching, and certainly any sore areas of the skin that doesn't heal within 4 weeks, looks different, it hurts, it bleeds, it becomes ulcerated, is itchy, or scabs and lasts for more than 4 weeks. Those are the really common aspects, and I would really advocate people look at ABCDE, which is very much available on the internet, very simple, straightforward, whereby it explains to you the changes that you look out for to pick up melanomas in particular.
You mentioned some myths there about vitamin D, and also people think when it's cloudy that they're quite safe as well. You hear some people as well, don't you, say, I've got quite dark skin, so I don't need to put on the protection.
Well, no, and you're absolutely right. It is a myth. Any skin can develop skin cancer. Brown and black skin can develop. This is not true at all. But the different types of melanoma are there. And as I said earlier on, in dark and brown skin, certainly palm, soles, nails, and the mouth. These are the areas to check, certainly. But any skin lesion that changes in any skin, it's worth actually getting medical advice and an examination.
And this time of year, the sun is especially strong, but this is something we should keep in mind all year round, really.
All year round, because UV rays do go through clouds. The sun, wonderful as it is, can actually produce these UV lights, UV rays, which can then actually cause changes in the skin, damaging the DNA, which can then turn into cancer. So even cloudy days, rainy days even, really important to make sure that you wear a hat, a wide brim hat, and certainly put on sun factor lotions, which are very important.
So what's the main message you'd like to get across about this campaign?
The message really is, look, we want to prevent cancer. We want to prevent skin cancer. Avoid blistering sunburn, avoiding tanning tables. Make sure that you cover yourself up with sun lotion. Wear brimmed hats to avoid the sun getting into your skin, especially the face and the upper body. Make sure you don't spend too much time in the sun, and get help and advice if there's any changes that you notice.
So where can we find out more?
Well, you can look at the NHS.gov website. You can find more information. You can find information on the Thames Valley Cancer Alliance website as well. which gives you lots of information about skin cancer and how to protect it. You can also look at the website Melanoma Focus. This is also very important and gives you a lot of information. In particular, really, especially if you have a family history of melanoma or if you're immune compromised. So people with organ transplants, those taking immunosuppressive drugs, these are all very important people with high risk. So it is worth looking at these websites.
And contacting our GP if we have any concerns as well.
Absolutely essential. Speak to your GP, get your skin looked at, and make sure that you get this diagnosed early if, unfortunately, you're someone who's going to suffer skin cancer.
Real pleasure to speak to you. Thank you very much for your time.
Thank you.
Online, on Radio Player, and on 106.6 FM. This is Wickham Sound.